Now, this is interesting. I have this article here that was shared with me, and this is on NPR. Obviously, National Public Radio is a reputable source. And this is about a psychiatrist who is apparently debunking 12-step recovery. This is Dr. Lance Dodds, and the book is by Lance Dodds and Zachary Dodds. And Dodds tells NPR that 12-step recovery simply doesn't work. Dr. Dodds says that the success rate of AA, based on a large body of evidence, so there's a large body of evidence now looking at AA success rates, and they say it's between 5 and 10%. So why is it that so many people believe that 12-step works so well? And he doesn't mention this here, but maybe in the book he does. There's something called survivorship bias, where you look at the survivors of something, the successes in a program. For example, you go to the gym and the gym is full of big muscular people and you're like, wow, this gym really works. People get big and muscular by working out here. And what you don't know is of those, say, 20 people that are big and muscular, how many people walked into the gym, tried it and left and never came back? There could have been thousands. So the success rate is not necessarily represented by the anecdotes or the stories or the successes that you see. If you go into an AA meeting, you're going to hear a lot of positive stories about, from people who are sober for 10, 20 years. But what you don't focus on as much are the quiet people in the back of the room, the people that have come and gone and never come back. And Dr. Dodds makes the argument that not only are the 90% that it's not working for, not only are they not getting any benefit, he believes that they're being harmed. Recovery programs are mandated by drug court, prescribed by doctors, and widely praised by reformed addicts. And that's true, but imagine that a drug court tells you have to go to 12-step meetings where the chairperson of the meeting will have to sign off on your paper from the court. To be compliant, legally compliant, you have to come back with a signed paper from someone at a 12-step meeting who's basically a volunteer. They're not being paid to do this. They haven't been certified or credentialed. They say, to its credit, AA describes itself as a brotherhood rather than a treatment. What should a person do? Should they go to AA? Well, why not? 5 to 10%. I mean, people go for chemotherapy for cancers where they have a success rate of 5%. People buy lottery tickets where they have a 1 in 15 million chance of winning, or sometimes even lower. Why not give it a try? It does work. It doesn't work as much as we would hope it works, but it does help. If it works against you, then maybe don't go. But what else can you do? You can go to your doctor. Naltrexone is a medication that blocks the effects of drugs known as opiates or narcotics. It competes with these drugs through opioid receptors in the brain. Originally used to treat dependence on opiate drugs, it now has also been approved by the U.S. Food and Drug Administration, FDA, as treatment for alcohol dependence. People who are dependent on opiate drugs such as heroin or morphine must stop their drug use at least 7 days prior to starting naltrexone. Some people should not take naltrexone. Naltrexone can reduce a patient's urge or desire to drink. Naltrexone helps patients remain abstinent. Naltrexone can interfere with the patient's desire to continue drinking more if she slips and has a drink. So naltrexone is a medication. It's a medical treatment for alcoholism. Disulfiram, antabuse, a drug used to support the treatment of chronic alcoholism by producing an acute sensitivity to ethanol, drinking alcohol. Disulfiram blocks an enzyme causing many of the effects of a hangover to be felt immediately following alcohol consumption. Disulfiram plus alcohol, even small amounts, produces flushing, throbbing in head and neck, throbbing headache, respiratory difficulty, nausea, copious vomiting, sweating, thirst, chest pain, palpitations, dyspnea, hyperventilation, fast heart rate, low blood pressure, fainting. Disulfiram, which is sold under the brand name Antabuse, is a deterrent. So if you're taking it, you're going to think twice about drinking because you're going to get really sick. There's also Vivitrol. Vivitrol is naltrexone. Same thing. The only thing is Vivitrol is a monthly injectable form of naltrexone, but it is approved for treating alcoholism. There is medical treatment for alcoholism. What else can you do? SAMHSA is a good resource. This is a government agency that implements a lot of programs to help with addiction and alcoholism. They have a national helpline, free, confidential, 24/7, 365 days a year. There's treatment locators, samhsa.gov. You can see a psychologist. In fact, you should see a psychologist if you are having a problem with alcohol. So you can see your medical doctor, and you can also go to AA. AA is not a program against you getting medical care. If it was, I would say don't go to it. But AA has no position on you getting medical care. One of the founders of AA, Bill Wilson, was very much in favor of the idea of medical treatment for alcoholism. And there's a story which is told in the book Overcoming Opiate Addiction by Dr. Adam Bazaga, where he tells a story of Bill Wilson and the founder of the methadone maintenance program. So those two had a meeting, and they talked about how great methadone is working to help people get off of heroin and opioids. I think heroin was really the problem at that time in the 60s in New York. And Bill Wilson said, is there any possibility of developing such a great, successful kind of a drug to treat alcoholism? Because it would be a lot easier for people to work their program and recover and get better if they had some kind of medical treatment to support them. And we do now. You just saw we have things like disulfiram, naltrexone. If you're trying to quit alcohol and you're drinking a lot, it would be a good idea to consider checking into a rehab program or a detox program, because there is some danger of when you stop drinking that you can have alcohol withdrawal syndrome, you can have a seizure. I mean, there is some danger to quitting alcohol abruptly without being under observation and treatment and care for a period of time. Talk to your doctor, but also consider going to a hospital, going to an inpatient residential rehab type program or detox program to detox you off of the alcohol. And then long term, your family doctor or an addictionologist can continue maintaining your medical care by prescribing naltrexone and maybe disulfiram or antabuse. Also, you can see your psychologist, family therapist. So there's a lot you can do. I would recommend, definitely getting the medical care in addition to going to AA. So that's going to be it for today. And thank you for joining me on this presentation of the Rehab Podcast.